It's 9 years ago since I got breast cancer, and it was a breast care nurse at Forster Hill. She said that I might be interested in going down this route, and so I never heard of mistletoe therapy before that, so I decided to come along, and it was the best thing I ever did.
And the live, that a very positive effect.
I don't know, but that possibly was the first major thing. I mean, I don't know that it was the mistletoe. The hospital were very surprised. They were amazed that there was no trace of cancer in those 21 lymph nodes.
According to my consultant, the cancer is gone. Well, we have long discussion with my consultant. He said we cannot call it a miracle because you were on mistletoe. So you were being treated. But he recognized that there is no explanation for the cancer to leave me.
When he examined me on that last day, he could feel no lesions. Now, after my intensive care, I had a scan, and there were many lesions on my liver and spleen that they could do nothing about, except to wait until I was well enough to have more chemo. I've never had more chemo. It's just been amazing. And the lesions were there, and then eventually they weren't there.
I just felt it made me feel better. But at the same time, the things that I had been told, it kills cancer cells, it shrinks tumours, it boosts the immune system, so why not give it a try?
As far as I know, mistletoe is useful. Mistletoe is beneficial for all types of cancers. In fact, I think Maurice said that in his talk. But when I first went to Park Atwood and had the mistletoe for the breast cancer, I think he started me off on ash, because the mistletoe that grows on the ash tree, because he explained that the constituents of the mistletoe in the form in which they occur on that host tree are particularly beneficial for breast cancer. Recently I was in Stroud in Gloucestershire, and a friend took me up a hill near her house, and I was overjoyed to see that some of the trees there had clumps of mistletoe growing on them, but I didn't see any of these really large spherical clumps like you see in the photographs. In some cases it was just a small little twig of mistletoe growing straight out of the branch. But it's not a parasite, you see, and it grows, and in fact some of the trees that it grows on are healthier than they would be if mistletoe didn't grow there, so it's not sucking the life forces out of the tree.
I got it in 3 different ways. I got it subcutaneous in my tummy, I got it as an IV drip, and I got it into the tumors. Into the tumors were the ones which created the fever, but the other ones were always right around it.
They start the mistletoe at quite a low level because there's different strengths. So I would have been on the lower strengths, because if you build it up slowly, you know, the doctor can assess how you tolerate different strengths, but not everybody can tolerate the same strengths, or different trees. I'm on ash and apple.
When you're well looked after, and you're you know, you're safe. There's a nurse there. You're looked after. I didn't have one worry about that. Only this fever to cope with. In a bed with a nice duvet around you and hot water bottles and herb teas, and it's not so bad. I didn't mind that so much. And then you had the feeling I was doing the thing I wanted to do most, which was hoping to get rid of this cancer without chemo.
It's a really positive sense of all I need to be doing at this moment in my life is having this fever. That is my task at this moment. And it's like a wonderful feeling of liberation, because for once in your life you know you're doing what you're supposed to. You're totally in harmony with what life is asking of you at that moment.
There is this tumour, is something not right. We don't quite know really what, you know, physically, you know, with the cells what cancer is, but we don't really know why people get cancer, why the one does and the other one doesn't. We don't really know what it is. And the body, for me, what it felt like, that the body had stored something up, which created that cancer, and that by heating it up, cooking it, something was able to dissolve, something was able to sort itself physically, but I felt it in my whole being, or something got organized, got sorted, got rid of. It was quite a specific experience in my life, which had been very, very hard. And the relationship to it changed because of in that fever. I knew exactly what was happening, and I can also remember it exactly. Something shifted. Nothing physically changed straight away with the tumor, but in me something had changed, what I trusted, which had straight to do with the mistletoe. And out of that, I trusted the mistletoe.
It's just, I don't know, it's a really comforting feeling. Just the whole experience. I mean, because it's given in a small cosy room and you're on a couch, you've got a duvet. Normally what happens is that I just cosy myself down and sleep for the duration of the treatment. But I just find the whole experience really relaxing, and it really does give you a warm feeling. And you just feel so much better afterwards.
No, just an itchy bit. That was about it, you know, just for the day after it was after I injected myself. No problems at all.
Not really. I was warned before I had my first treatment that I could have side effects, flu-y, shivery feeling, and I was told that some people say it's worse than a really bad flu. But to be honest, I seem to tolerate the doses quite well. I do get shivery. It is an uncontrollable shivering, and it really does feel like you've got a bad flu coming on, lots of aches and things. But usually I just go to bed with a hot water bottle for a couple of hours and it passes, and after that I'm fine. And it seems to bring on an appetite. So, and it's almost like flicking a switch, you know, the energy levels. My partner said it's, you know, sometimes by the time I've come from therapy, it's been a few weeks, and I'm really tired and lethargic. And he said it's almost like flicking a switch on the car on the way home, that the energy levels go up straight away. So, no, really the side effects haven't put me off at all. It's certainly not as bad as chemotherapy. So.
No, I haven't had chemo. As I like to say, I didn't take up the invitation to have chemo and radiotherapy, and Maurice Orange at Park Atwood, he did at one point say to me, don't rule out chemotherapy. And so I understand that my situation was that there was no guarantee ever that the mistletoe on its own would be enough. The surgeon certainly recommended operation, chemotherapy, radiotherapy, and then probably one of the hormone treatments, except that I wasn't receptive to those hormone treatments. So, I think I've been very fortunate.
So afraid of chemo. I would do anything to try to avoid chemo. That was my starting point.
Because I was able to be on the mistletoe right from the start, even before the surgery, and that you do have this sense of well-being, and you have this sense of being taken care of in a bigger way than just the surroundings. And the way I used to put it to myself is that I felt I was guided and protected every step of the way.
You're diagnosed, and then you get the prescription. You have a chemo. I would have been given in the normal hospital. There was a chemo and possibly a radiation afterwards. It was a set treatment with a beginning and an end. And if it would gone well, which was a big chance that it would have worked, this would have been it. And we would have known from the beginning this is what we were hoping to get. Mr. Mistletoe never worked like that. He did a little bit on the way, and then he had to see how I was doing with it, and in that situation decide together with the doctor, like a team really, what is the next step, and then a little bit next on, and you do a few more steps and you would see how I was. So
when I was going through chemotherapy, I was really sick. For about a couple of days, I could hardly raise my head off the pillow. I was so sick. And as soon as I was able to inject myself, I just felt like my spirits had lifted. It was an amazing feeling. But and each time it was exactly the same. But it took 2 or 3 days because I had to wait about 2 or 3 days to do this. And as soon as I did it, I just felt absolutely different.
And I believe that I've not had any side effects from the chemotherapy or the radiotherapy because I've been on the mistletoe before I went on the treatments. So that's, my immune system was strong anyway. And now getting this is what I believe anyway, of what I've read about the Parliamentary medicine. I think it does it. I think it helps you beat off infections or stops you getting them. Most of the people I saw in the chemotherapy units and all the places I were very depressed, very low in spirit, very ill looking, with all the side effects they were having from pills, water retention here and this and that, and dry skin, obviously with all the chemo. I went through it and the only thing I lost, I was quite hairy, was my hairy chest kind of thing. My wife likes it. But no hair, no. And it just stopped in July there, my chemo. And like I say, I just got back a couple of weeks ago and I just finished my radiotherapy on Friday there.
The mood swings, I felt beforehand, I suppose, desperate. I didn't know what was happening. I just felt totally at, I suppose, my lowest ebb. But when I started taking the mistletoe, I just felt better. I just felt it gave me hope, gave me confidence.
It was actually one of my district nurses who suggested it.